As first-time parents, it's incredibly common to notice unusual behaviors, peculiarities, and other small things that your newborn does that, at first glance, can be quite alarming and even terrifying. However, many of these things that may cause worry are actually completely normal and are simply part of your baby's natural development. And the last thing you need as a new parent is more stress and anxiety added to your already overwhelming plate. So let's talk about some of the most common things you might observe that seem strange or concerning, but are actually totally normal, and where exactly the dividing line is between normal and something that requires medical attention. Your baby's safety matters. Like the video and subscribe so you never miss a tip that could protect your little one. Your peace of mind matters, so let's get started. Newborn tremors and jittery movements. Starting with newborn tremors and jittery movements. In newborns, the pathway that transmits signals from the brain to different parts of the body isn't fully developed yet, and this incomplete development can cause sudden, jerky, or jittery movements that can look quite dramatic and scary. It's very common to observe these trembling movements when your baby is falling asleep or already sleeping, when they're crying intensely, when they're hungry, or even when they're startled by a sudden noise or movement. As your baby's nervous system gradually matures over the first few months, these movements become much smoother and more controlled, and the movements of their hands and legs become significantly more coordinated and purposeful. However, if you suspect seizures or are worried about involuntary movements that seem excessive or different from normal jitteriness, don't hesitate to call your pediatrician to get confirmation and peace of mind. Here's a really helpful tip. Record any suspicious activity from your baby, such as the jerky or jittery movements that concern you, and take that video recording to your appointment with the pediatrician. This way, the doctor can actually observe what worries you in real time and either reassure you that it's normal or recommend necessary treatment if the movements are more than just typical newborn jitters. This documentation is incredibly valuable for accurate diagnosis. Crying without tears. Another thing you'll definitely notice is that newborns cry quite a lot, sometimes for hours, but they don't actually produce visible tears when they cry. This can be genuinely concerning, especially when you see your baby's face red and scrunched up in obvious distress but completely dry. However, not producing visible tears immediately after birth is completely normal and expected. This happens because the lacrimal glands, which are the tear-producing glands, initially produce only the minimum amount necessary to keep the eyes moist, lubricated, and healthy. The production of emotional tears that you can actually see rolling down their cheeks only begins to become visible around 1 to 3 months of age, when babies are upset or crying. Some babies start producing visible tears even later, around 4 months, and that's still within the normal range. Producing visible tears is actually one of many small developmental milestones that your baby will achieve in their first year of life. And if you want to know what other amazing skills and abilities your little one will learn before their first birthday, click the link in the description below to get your free developmental milestone PDF. This comprehensive chart will help alleviate some of the stress and uncertainty you might have in their first year, as well as give you a clear indication of when you need to be concerned about your baby's achievement of their milestones versus when things are progressing normally. Watery eyes and blocked tear ducts. While we're on the topic of eyes, another thing you may notice is that your little one's eye or both eyes start to water constantly and excessively, even when they are not upset or crying. And immediately you and others around you may think that your baby has conjunctivitis or pink eye, which is an infection. And this is exactly what I thought when my firstborn's eyes started to water constantly during his second week of life. I was convinced he had an infection and was quite worried. So let me explain what's actually happening. Tears are made by glands located underneath the eyelids, and these tears wash over the surface of the eyes to keep them moist, clean, and free from debris, and then they normally drain through small channels called tear ducts. However, when the tear duct is blocked or too narrow, which is very common in newborns. The tears simply cannot drain properly and they overflow constantly from your baby's eye or eyes, sometimes creating a crusty discharge. Babies with blocked tear ducts usually show symptoms between birth and 12 weeks of age, and this usually isn't a serious cause for concern. Most cases of blocked tear ducts will resolve completely on their own by your baby's first birthday without any intervention needed. However, if you notice your baby's eye is red, inflamed, or their eyelid is swollen and puffy, then it's important to check in with their doctor promptly to rule out any actual infection that might require treatment. And also, it's important to see your doctor if the blocked tear duct hasn't resolved and gone away by the time your baby is 1 year of age, as sometimes a minor procedure might be needed to open the duct. In the meantime, you can gently massage the tear duct area to help it open, which your pediatrician can show you how to do correctly. Spitting up and reflux. You may also notice that your baby spits up frequently or has reflux, which can seem alarming when you see large amounts of milk coming back up. Now, spitting up or reflux is something a lot of newborns and young babies experience regularly, and this is because the sphincter muscle that sits between the esophagus or food pipe and the stomach is immature and doesn't close properly or tightly yet. And because their entire diet consists of breast milk or formula, which is completely liquid, it easily flows back out of this opening and up through their esophagus, into their mouth and then out of their mouth, sometimes quite projectile. It can look like a lot of milk, but usually it's less than you think. Now, the majority of babies do not tend to be bothered at all by the spitting up, and most infants will stop spitting up once their sphincter muscle matures and strengthens, and once they start to spend more time sitting upright rather than lying flat. As long as your child is happy, content, and gaining weight appropriately according to their growth curve, you don't need to be overly concerned if they do spit up regularly after feedings. However, for some babies, reflux or spitting up is genuinely painful and distressing, and it can lead to poor weight gain, arching during feeds, refusing feeds, or excessive crying. And for these babies who seem to be suffering, it's important to talk to your pediatrician about what the next steps may be, which might include medication or other interventions to help manage their discomfort. Baby acne. You may also notice your newborn's smooth, soft, perfect skin starts to develop small red bumps or pimples on their cheeks, nose, chin, or forehead. And if these small red bumps develop within the first 2 to 4 weeks after birth, appearing suddenly and spreading across their face, it is highly likely that your little one has baby acne, which looks remarkably similar to teenage acne. Fortunately, there's absolutely no reason to be concerned about baby acne, which occurs in approximately 1 in 5 newborns, so it's very common. Unfortunately, there is nothing that you can actually do to prevent your little one from getting baby acne, as the exact cause of it is still unknown and somewhat mysterious. Some researchers believe that it's due to maternal hormones still circulating in your baby's system after birth, where others believe it's because the pores in your newborn's delicate skin aren't completely developed yet and your baby may be susceptible to developing acne caused by some external irritant like fabric softener or laundry detergent. But the good news is that the baby acne will usually clear up completely on its own within 3 to 4 months without any treatment needed and without leaving any scarring on their beautiful skin. Don't pick at it or use any acne treatments, just leave it alone. Now, if you are concerned that your baby's skin irritation could be something more serious than baby acne, like eczema or an allergic reaction, or you're concerned about any aspect of your baby's complexion or skin condition, it is important to consult with their doctor or pediatrician, just to be absolutely sure and get proper guidance. Misshapen head. You may also notice that your newborn's head appears to be misshapen, oddly shaped, or asymmetrical. And it's extremely common and actually expected for newborn babies to have an unusual shaped head right after birth. And this could be due to the position they were in while curled up in the uterus during pregnancy, or it could be caused by molding, which is that temporary changing shape of the head during labor as they pass through the birth canal, or it could be due to instruments like forceps or vacuum that were used during delivery to assist the birth. So for example, your baby's head may look a little squished, cone-shaped, or elongated if you had a particularly long labor, or if you had a vaginal birth rather than a cesarean section. This molding is actually designed to help babies fit through the birth canal more easily. Now, most babies' heads should gradually go back to a normal, rounded shape within about 6 weeks after birth as the skull bones shift back into their proper position. However, if you notice at around 6 to 8 weeks of age that your baby has developed a persistent flat spot on the back or side of their head, or they continue to have an unusual shaped head that isn't improving, then do make sure you check in with a pediatric physical therapist or physiotherapist as soon as possible. This is to make sure your baby doesn't have positional plagiocephaly, which is flattening from pressure, or craniosynostosis, which is a birth defect in which the bones in the baby's skull actually fused together too early before birth. Craniosynostosis can have a serious impact on that developing brain and does require urgent medical treatment and sometimes surgery. And while you're waiting for that appointment, the next thing you want to do is actually check out the video linked in the description to find out what you can start doing today to prevent that flat spot from progressing from a mild flattening to a severe case that might require helmet therapy. Crossed eyes. Another thing that often worries new parents is when their baby's eyes appear crossed or don't seem to move together in coordination. In newborns, it's completely normal for their eyes to occasionally wander or appear crossed, especially in the first few months of life. This happens because the muscles that control eye movement are still developing and learning to work together. You might notice this especially when your baby is tired, trying to focus on something very close to their face, or when they're looking to the side. However, by around 3 to 4 months of age, your baby's eyes should start working together consistently. If you notice that one or both eyes continue to turn in, out, up, or down persistently after 4 months of age, or if one eye seems to wander constantly, it's important to have your pediatrician check for strabismus or amblyopia, which need early treatment for the best outcomes. Breathing irregularities. You might also notice that your newborn's breathing pattern seems irregular or concerning. They might breathe rapidly for a few moments, then slowly, then pause for several seconds before breathing again. This periodic breathing is completely normal in newborns and young infants. Their respiratory systems are still maturing and learning to regulate breathing patterns. However, if your baby stops breathing for more than 10 seconds, turns blue or pale, or seems to be struggling to breathe with flared nostrils or retractions where you can see their ribs or chest pulling in with each breath, seek medical attention immediately. Also, consistently rapid breathing over 60 breaths per minute when your baby is calm and resting warrants a call to your pediatrician. These are just some of the many normal but alarming-looking things newborns do. Remember, when in doubt, always check with your pediatrician. It's always better to ask and be reassured than to worry unnecessarily or miss something important. If you found this video helpful, please hit that like button, subscribe to the channel for more newborn care tips, and share this with other new parents who might need this reassurance. Thanks for watching, and I'll see you next week for more parenting tips and tricks that will make your life easier.